Today is Germsday Thursday. Today's germ topic is on that of influenza.
It's Germsday Thursday. Time to learn a little bit about different germs. Time to learn about that bacteria and those viruses. Don't forget the fungus among us.
Welcome to my YouTube channel. Welcome to my nursing channel. My name is Nurse Master Charlie. And if you are a returning visitor, then welcome back and a big thank you for your support. If you are new here or just stumbled across my channel, then welcome. I'm glad you are here. Stay a while, watch and listen. On my channel, I talk about and share about nursing school related topics and tips, as well as health related topics. And if you like what you see in here, if you want to learn more about nursing and health related topics, then please be sure to subscribe, like this video, and hit the notification bell. Hopefully we can become virtual friends and or virtual colleagues. Like I said, today is Germsday Thursday. Normally, my Germsday Thursday topics are done in a shorts format with a duration of 30 to 60 seconds. My Germsday Thursday videos are not going to be shorts for this series. They're going to be just a little bit longer. This series is going to entail the various germs that are associated with the most common vaccines. Today's germ topic is on that of the flu shot or the influenza vaccine. Have you ever wondered about the flu shot or why you should even get it and why every year? So first, what is influenza? The influenza virus, or better known as the flu virus, is a contagious virus that can cause a respiratory illness. There are over 100 subtypes of the influenza virus, and the ones that circulate yearly mutate or change. And that's the flu's genetic code that allows this mutation to occur rapidly and often because it's not a perfect system for duplicating itself, which is the main problem. The virus enters the person's body through the air, breathed in, or from touching surfaces and then touching our face, our nose, our eyes, and then it infects the nose, the throat, and sometimes the lungs. To make it worse, the virus can survive without being on a human for hours. Once it gains access to a person, it can then circulate into the person's bloodstream, enter a person's cell, take over a cell, then it multiplies itself, clones itself within the cell, and causes the cell to basically explode. This then releases more of itself into the circulation to do more of the same to other cells, thus making us sick. Now, a person may be infected and contagious yet show no symptoms, even a day before they even feel sick. Even after they are better, they can still infect others up to 2 weeks after. Right, to share a little immunology and science, the flu viruses is made up of RNA, and this RNA is copied within a person's cells. Sometimes the RNA is not copied exactly, and this is what causes the various and mutated types of the different flu viruses. So now a vaccine. First, a vaccine usually contains some inactivated particles that make up the virus so that our body can recognize it. These particles are called antigens. So normally our body's immune system uses these antigens and develops antibodies against them to stop the spread of a virus. But as the virus changes and mutates, the body's immune system may not recognize these newly mutated viruses, leading to infection. Now take into account that I mentioned earlier that there are over 100 different types of influenza viruses. These are always changing, and two viruses can get together and actually form their own new strains. There are various types of influenza, which are A, B, C, and D. Okay, so what are flu symptoms? Flu symptoms include fever, headache, sore throat, coughing, sneezing, runny nose, and fatigue. Symptoms can be mild, but also to the extreme of hospitalization. So why is the flu bad? The influenza virus has been around for a long time, and this has given time for the virus to mutate. So how bad is the flu, and why do we need a vaccine? Well, here's a great statistic of what can happen without a vaccine, and a little history. In 1918, before any type of vaccine existed, 50 million people died worldwide. That is approximately 1/3 of the world's population at that time. So I mentioned that there were different types of flu viruses. In 1933, scientists isolated the influenza A virus and learned that it was not a bacteria, where antibiotics, which were discovered in 1928, would work against a bacteria, but antibiotics would not work against a virus. And in 1936, the influenza B virus was isolated separately, and it was discovered that the flu virus vaccine could be grown in hen's eggs. In 1942, a two-component vaccine was produced that offered protection against both influenza A and influenza B. Consider this to be the predecessor to the ones we use today that contain 3 or 4 different virus components. In 1945, the first flu vaccine was licensed for civilian use in the United States. Since then, in the United States, there were 2 pandemics, one in 1957, killing more than 1 million people nationwide, and one in 1968, killing 100,000 people in the United States, mostly people aged 65 and older. It was also learned as early as in 1947 that flu viruses change from year to year, and the vaccine would need to be adjusted annually to be effective. The flu is no joke. If no vaccine existed to curb the virus, it could possibly continue to kill people like it did back then. So why do we need to even get the flu shot? The flu shot contains inactivated viruses that scientists from the World Health Organization learned from studying throughout the year and from previous years which are the most probable versions of the virus to be circulating for the upcoming flu season. This is where the vaccine is formulated. Scientists can predict from studying which virus strains will be the dominating strain, or more to cause you to become really sick. The vaccine usually contains 3 to 4 types of inactivated viruses in one, also known as trivalent or quadrivalent. These give your body the ability to create antibodies to the virus before you get infected. Remember, there may be 96 other subtypes out there that might not be as powerful or strong, but they still can give you the flu. And the virus can still mutate and change during this time. That's why it may not prevent the flu entirely. However, it may make less infection, less symptoms, shorter duration as the body recognizes some antigens due to the antibodies produced from the vaccine. It can reduce your risk of getting the flu by approximately 50%. You cannot get the flu from the flu shot, but you can get an immune response that can cause you to feel fatigued and maybe a little bit achy. The reason you cannot get the flu from the flu shot is because the vaccine contains an inactivated version of the virus, unlike if you breathe in or touch a surface with an actual live and activated virus. Have you ever heard of herd immunity? This is where a majority of people get the influenza vaccine. They create the ability to fight the virus, decreasing its spread, which in turn protects those who cannot get the vaccine. So speaking of, if you can get the vaccine, get it. But there are some people that should not get it. Children younger than 6 months of age, people with allergies to any ingredient in the flu vaccine, such as eggs. However, talk to your care provider about that. Previous reaction to the influenza vaccine, those with a history of Guillain-Barré. There's also a nasal spray flu vaccine, but talk to your doctor about this as it is approved for people 2 years of age to 49 years of age, including people with egg allergies. The nasal spray vaccine is not recommended for some groups, so make sure you talk to your doctor. Vaccines generally become available in the fall for the flu vaccine. So who should receive the flu shot? The CDC, or Centers for Disease Control, recommends healthcare personnel, especially healthcare personnel who are caregivers of their own personal children under 5 years of age or adults age 50 years or older with medical conditions. So to all of you healthcare providers, you don't want to take a highly contagious and live strain of the flu virus home with you. Who else should receive the vaccine? Well, children aged 6 months through 4 years of age, people aged 50 years old and older, extremely obese people, people with chronic pulmonary diseases, cardiovascular diseases, blood diseases or disorders, liver disease, kidney disease, and also diabetes. Also people who are immunosuppressed, people who are residents of long-term care facilities, women who are or will be pregnant during the influenza season, and people up to 2 weeks after delivery, and American Indian or Alaska Native persons. So with all that said, how do you prevent the flu or catching the flu? First, as always, by washing your hands. Stay away from people who are sick if possible, and get the flu vaccine yearly. Now, if you want a fun way to learn the basics about the flu shot, but through music, please be sure to listen to my The Flu Shot song, which is on all major streaming platforms, as well as a lyric video here on YouTube. So if you found value in this video and hopefully learned a little something about the influenza or the flu vaccine, please be sure to give this video a like as it helps out my channel. And if you are interested in nursing/health related content like this, please be sure to subscribe and hit the notification bell so you can be made aware of when I make new videos, especially if you want to follow my series of Germsday Thursday videos over the next few months. So don't forget to share this video with those who may benefit from this information, and especially those who are in nursing school, starting nursing school, or are pre-nursing. So please be sure to check out my other nursing and health related topic videos, and also my shorts videos, which are about health, food, sugar, and medication related topics. Also check out my nursing related music lyric videos here on YouTube. You can also find me on my website www.nursemastercharlie.com, and you can listen to my music on all streaming platforms. I'll leave a link in the description. So until the next video or the next Germsday Thursday, God bless and goodbye. And if possible, get your flu shot.
Everybody needs the flu shot. Everybody needs a flu shot. 'Cause those germs just don't stop. They just don't stop. Everybody needs the flu shot. Everybody needs a flu shot. 'Cause those germs just don't stop. They just don't stop. Everybody needs the flu shot.